Hello and welcome to a presentation here today from NIB Health Funds. My name is Corinne and I'm excited to speak to you about the partnership of NIB and NatRoad to help deliver some health and wellbeing focus for NatRoad members. So we've joined together, well aligned to bring some tangible benefits for NatRoad members and to help you to enjoy a better life. So I'll talk through today what the offer is for you, and whether you're looking through the webinar or you're listening in your car, I hope that you can grab something from this. So while all of Australia has, or all Australians have access to public hospital at no charge, the public system doesn't always cover people for the cost of everything that you might need to stay well. So this partnership has enabled you to access some benefits from a private health insurance provider, NIB, which can help you to skip public waiting lists, choose specialists in hospital, and help you to maintain your health, not just look after yourself when you're sick. So what's in it for you? As a NatRoad member, you can receive up to 10% of a national discount, so Australia-wide, on your products, so for yourself and any of your family or members on that policy. So up to 10%. The reason we say up to is there are some older products that might not have that discount applicable. Really important to call the contact centre if you're a current NIB member, and they can talk you through that process. We'll give you the number later. Or if you're new to NIB, that 10% discount can apply. So being an NIB member and with a NatRoad membership as well, any 2 and 6 month waiting periods will be waived for you if you're joining a hospital and extras policy. So that means anything like physio, chiro, general dental, remedial massage can be claimed on straight away. You'll have access to NIB Healthy Rewards through NIB Well, which is an additional wellness app that we have, and you get access to NIB's first choice providers. So that's both hospital and clinician network with a locked-in lower cost. So that helps you to avoid those out-of-pocket costs that we sometimes see when we're looking at healthcare. We've also got a lot of clinician-led health support programs, so things to do with mental health, chronic disease, and home support programs. And this helps you to, one, either stay out of hospital or to get back to your healthiest self after coming out of hospital. Now, the next few things I'm going to talk about are government initiatives that go into making up the price of your product. So while we would love to be able to say X product costs Y dollars, unfortunately, there's a few contributing factors that go into that, as well as some government initiatives that help you to compare health insurers. So we'll start going through those now. The first initiative that we wanted to talk about is the hospital tiering system. So back in 2019, what we see as a welcome change, the Australian government introduced a tiering system to guide consumers like yourself through hospital cover choice. So the hospital covers are broken up into 4 segments: gold, silver, bronze, and basic. And to meet that criteria to be called a silver cover or a bronze cover, we have to meet a minimum amount of hospitalisation procedures. So with those covers, we have some of our hospitalisation covers who might say, for example, Bronze Plus, which have met the minimum requirement to be a bronze cover and have a couple of additional items in there, but haven't quite met the silver cover. But having these 4 tiers allows you to really clearly and really simply, if you're in another insurance company, to compare apples with apples. So if you're currently with another provider, you have a silver hospital cover and you want the exact same level of hospital cover if you move over to NIB, covered for the same procedures, then you can move to a silver cover and know that we are still covering you for the same items. So this is especially important for you not having to navigate through if your health insurers are calling the same procedures the same thing. So someone might be saying a minor eye surgery, someone might be saying major. This tiered option allows you to compare, like we said, apples with apples. Our next thing that we'll talk about today is the Medicare Levy surcharge. So if you're an Australian taxpayer who doesn't have private health insurance and you earn over a certain amount, and if you're lucky enough to be looking at the webinar, you'll see the table there, you may have to pay a Medicare Levy surcharge. So Australian taxpayer pays the Medicare Levy, but there's an additional surcharge that we have to pay if you're earning over $90,000 as a single or $180,000 as a couple or family. The next one we'll move on to is lifetime health cover loading, or LHC loading. So this was an initiative that the government implemented in the year 2000. It's a little bit of a tricky one, but if you don't join hospital cover, private hospital cover, on the 1st or before the 1st of July, following your 31st birthday, you can be charged up to 2% for every year you're over the age of 30. So I know that that's a massive mouthful, but basically what it says is that you can be charged anywhere between 2 and 70% extra on your hospital cover, and that loading will apply for 10 years until you've served 10 years of hospital cover, and then it will be automatically removed. If you do think this applies to you, or if you've got any questions about loading, you're best to either jump onto the website and have a read through the lifetime health cover loading, or give us a call on 1800 13 14 63 to talk to a trained consultant. One of the next, I guess, initiatives which came out back in the 2019 as well is age-based discounting. NIB is a little bit different to other corporate health insurers, where we offer this age-based discounting on top of your corporate discount or your NatRoad discount. So basically this one works as I like to think of it, as the opposite to LHC. So if you're joining hospital cover before you turn 30, you can save up to an additional 10% up until your 40th birthday, and then it starts to trail off from there. Again, if you think that this applies to you, definitely give us a call and we can make sure, one, that it's applied on your policy, and two, that you understand that properly. And now the last of our really exciting government rebates is, or government initiatives, is the Australian government rebate. Now, the Australian government rebate was implemented to help make health insurance more affordable. And it's basically the government is helping to co-pay or to discount your health insurance for you up to a certain percentage. Now, this is based on whether you're a single, couple, or family, how much you earn, and what age you are. So how we work this out, there's base tier, tier 1, tier 2, and tier 3. If you're not looking at the table, it will be horrific to try to read it to you and understand. But as an example, if you're a single earning $94,000, putting you into tier 1, and you're under the age of 65, you can get a rebate of 16.405% of your premium. And they can be claimed two ways. One is a discounted premium, so whether that's monthly, fortnightly, whatever your pay frequency is for health insurance, or you can claim it at tax time. Now, if you are claiming at tax time and you've selected the wrong tier, or if you're claiming through, if you're claiming as a reduced premium and you select the wrong tier, then that will be reconciled at tax time, depending on your income. So that's it for government initiatives. So we'll go back to what's in it for you. So if you're joining NIB today and you're a member of NatRoad, you can get a national discount, so Australia-wide, of up to 10%. You'll get a 2 and 6 month waiting period if you're joining a hospital and extras covered together. We will waive those waiting periods. You have access to our first choice provider network, NIB Rewards and NIB Well, so passing on discounts with NIB Rewards, helping to keep you well with NIB Well. And if you're joining between the 1st of July, the 1st of June and the end of the financial year, you will also receive our campaign that's running for new to NIB members, which is 30 days free. So give us a call and we can talk you through more of that, or you're welcome to jump on to our online NatRoad portal to join yourself. So if you're an existing member wanting to add in that discount, give us a call. We'll see whether your cover's eligible, but at least we can do or at the very least, we can offer you a cover review to ensure that you're on the right cover, and then hopefully adding that discount on for you. If you're switching to NIB, either go onto our website, www.nib.com.au/corp, CORP/NatRoad, and you can self-serve and get a quote, calling 1800 13 14 63, mentioning that you're a member with NatRoad, or emailing helpmeswitch@nib.com.au, and they'll be able to provide information to you via email. So if you're switching to NIB, another thing to note is that we will honour any waiting periods that you've served with your previous provider. So any waiting periods that you have served and you're already covered for, you'll be covered for automatically with NIB if you select the correct level of cover. So that was a lot of information for you. I guess the big call out for me is make sure you give us a call, talk through what your options are, and we'll be able to give you a quote over the phone. We can do all of the joining over the phone as well if that's what you need, or you can log on to either the email or the home web address, the NatRoad web address to set yourself up a quote. And that's it for information from me today. Thank you very much for listening or watching, and we hope to talk to you soon.